Well, there's this sudden crescendo of noise, then a profound and jarring explosion of sound, electrical fizzing, and a bright flash in my vision, like someone has lit a spotlight in front of my face. This is what patients of exploding head syndrome have to say. No, this really isn't a made-up name, but a real syndrome, and definitely a mysterious one. What then really is the science behind it? Also known as parasomnia, exploding head syndrome is actually a sleeping disorder. People with EHS hear loud noises or crashing, explosive sounds. It happens either just before they are falling asleep or in the middle of the night when they wake up. Well, the sounds can be similar to gunshots, thunder, explosions, clapping, lightning strike, and cymbals crashing. The weird part, it's all in the person's head. The sounds are not real and no one else can hear them. There's not one clear reason as to why does it really happen. But some of the reasons, according to experts, are as follows. Minor seizures in the temporal lobe of the brain. Damage or dysfunction in the inner ear structures. Abnormal attention processing in your brain during the sleep-wake transition. Side effects from suddenly stopping selective depression medicines, and also benzodiazepines, which are used to treat anxiety. Stress and anxiety in itself can be some of the reasons. After these episodes, the person is left feeling frightened, anxious, and finds it difficult to fall asleep again. Some people also experience sudden muscle jerks while the episode happens. While the name of the syndrome does sound painful, there's no pain really associated with it. So is it common? But is it even that common that we are talking about it? Well, according to a research, about 10% of the population will experience this once in their lifetimes, and it's more common among women. There are certain criteria according to the International Classification of Sleep Disorders which can help identify this. Your sleep specialist is going to ask you if you woke up suddenly to a loud noise or an explosion in your head, if you felt frightened after the episode, if you're experiencing physical pain during or after the episode, if you saw flashes of light during your episode, if you had any muscle twitches during this. These are some of the questions that's going to be asked. The confirmation of these criteria will give an idea if you indeed are suffering from EHS. EHS has also been compared to sleep paralysis, which is a feeling of being conscious but unable to move. Both are different, but studies show that people who already have other sleeping disorders are possibly going to have this too. There isn't really a specific treatment or medicines for this syndrome, but some doctors might suggest anti-seizure medicines and antidepressants.
For more informative videos like this, keep watching India Today News Mo.